ever notice how the conversation about sex and intimacy just stops after a certain age? People talk about sex at 50. People talk about sex at 60. But at 70, the assumption is that it's over, that you're past that intimacy becomes irrelevant. But here's what the research actually shows. Intimacy doesn't end at 70. It changes, but it doesn't end. And not understanding how it changes means a lot of men over 70 think something is wrong with them, when really they're just experiencing a normal evolution of sexuality and intimacy. In the next few minutes, I'm going to walk you through what research shows about intimacy after 70, how it actually changes, what causes those changes, and most importantly, what you need to know so you can continue having a satisfying, intimate life well into your 70s and beyond. The first thing research shows is that sexual desire doesn't disappear at 70. A groundbreaking study from AARP found that 63% of men over 70 report being sexually active. 63%. That's not a small number. That's the majority. But more importantly, the study found that men over 70 who have partners and who are in healthy relationships reported that sexual satisfaction didn't decrease with age. It evolved. So the myth that you stop wanting sex at 70, the research says that's not accurate for most men. What actually happens at 70 is that the experience of sexual arousal changes. It takes longer. A study from the Journal of Sexual Medicine found that men over 70 take significantly longer to achieve full erection compared to younger men. But here's the part that matters. The arousal still happens. It still builds. It just follows a different timeline. A man in his 30s might be ready to go within minutes. A man over 70 might need 20 or 30 minutes of foreplay and stimulation. That's not dysfunction. That's just a different rhythm. The second thing research shows is that the physical changes are predictable and manageable. Around 70, most men experience some changes in erectile function. This isn't failure. This isn't a sign that your sexuality is ending. This is physiology. Research from the American Academy of Family Physicians shows that erectile changes after 70 are primarily due to cardiovascular changes, not diminished desire. Your cardiovascular system has to work harder to maintain erection. It's not that you don't want to, it's that the blood flow dynamics have changed. But here's what's important. Understanding the cause means you can address it. If it's cardiovascular, then cardiovascular health matters. Exercise matters. Not smoking matters. Managing blood pressure matters. Some men benefit from medications like Viagra. Some men find that focusing on the arousal process itself rather than rushing through it addresses the issue. Some men find that their partner's understanding what's actually happening removes the performance anxiety that was making it worse. The third thing research shows is that sexual frequency does tend to decrease after 70, but not as dramatically as people assume. A study tracking sexual frequency over decades found that men in their 70s who have partners have sex on average 2 to 3 times per month. Men in their 60s have sex on average 3 to 4 times per month. That's not a drastic drop. That's a gradual decrease. And more importantly, the men who reported having the most satisfying sex lives weren't the ones having sex the most frequently. They were the ones who felt comfortable and connected with their partner. Quality over quantity becomes even more important at 70. The fourth thing research shows is that health conditions matter significantly. After 70, many men are dealing with health issues: diabetes, hypertension, heart disease, arthritis, depression, and all of these affect intimacy. Research from the Journal of the American Medical Association found that men over 70 with well-controlled chronic conditions had sexual function comparable to men in their 60s without those conditions. So the key factor isn't age, the key factor is health management. A 70-year-old man with a heart condition who's managing it well might have better sexual function than a 65-year-old with uncontrolled diabetes. The fifth thing research shows is that medications play a huge role. After 70, most men are on medications, and a lot of those medications affect sexual function. Beta blockers for heart disease, SSRIs for depression, diuretics for hypertension, antihistamines for allergies. All of these can interfere with sexual function. But here's what matters. If a medication is interfering with intimacy, you can often work with your doctor to change it. There are alternatives. There are different approaches. The issue isn't that sex stops working at 70. The issue is that you have to be more intentional about it. You have to pay attention to what's working and what's not. The sixth thing research shows is that psychological factors matter more at 70 than they do at younger ages. Performance anxiety, worry about health, concern about appearance, fear of rejection, all of these increase at 70. And anxiety kills arousal. It kills the ability to be present and feel pleasure. Research from the Journal of Sexual Medicine found that men over 70 who were anxious about their sexual performance had significantly lower erectile response than men with similar health profiles who weren't anxious. So the solution isn't often medication or treatment. The solution is reducing anxiety. It's building confidence. It's creating safety with a partner. The seventh thing research shows is that sensuality becomes increasingly important. After 70, the full-body sensory experience of intimacy matters more than it does at younger ages. Touching, kissing, caressing, time spent together, attention to pleasure from the entire body, not just genital pleasure. Studies show that men over 70 who reported the most satisfying intimate lives were the ones who had broadened their definition of sexuality beyond just penetrative sex. They were enjoying touch, they were enjoying connection, they were enjoying the time spent with their partner, and within that broader framework, sex happened naturally. The seventh thing research shows is that emotional intimacy directly correlates with physical intimacy at 70. A man over 70 who feels emotionally close to his partner, who feels safe and appreciated, has significantly better sexual function than a man in a distant relationship. Because at 70, sex isn't just physical, it's the physical expression of an emotional connection. The ninth thing research shows is that continued sexual activity actually improves sexual function in men over 70. There's a use it or lose it reality. Men over 70 who continue to have sexual activity regularly maintain better erectile function and better overall sexual satisfaction than men who become less sexually active. So stopping sexual activity because you're worried it won't work actually makes it more likely that it won't work. The 10th thing research shows is that women over 70 want intimacy too, and they often want it more than their partners assume. An AARP study found that 43% of women over 70 are sexually active, and of those women, 71% reported that sex and intimacy are important to their quality of life. Many men over 70 stop initiating because they assume their partners don't want sex, but research suggests that's often not accurate. Here's what all of this research adds up to. Intimacy doesn't end at 70. It changes. It requires more attention. It requires more communication. It requires more intentionality. But it's absolutely possible. And for men who understand how to work with these changes, it can be deeply satisfying. The most important thing is communication with your partner. Talking about what's working, talking about what's changing, talking about what you both want and need. Because at 70, trying to maintain a performance that worked at 40 is what causes problems. Understanding that you're both evolving and figuring out what works now is what creates good intimacy. The second most important thing is managing your overall health. Exercise matters, sleep matters, managing stress matters, managing blood sugar matters. These things affect sexual function more dramatically at 70 than they do at younger ages. The third most important thing is removing performance pressure. At 70, sex doesn't always have to lead to erection and penetration. Sometimes it's about connection. Sometimes it's about touch. Sometimes it's about being intimate without the pressure of performing. And paradoxically, removing that pressure often makes performance better when it matters. Here's what I want you to understand if you're over 70 and wondering if your intimate life is over. It's not. The research is clear. Sexual desire and sexual satisfaction are possible well into your 70s, 80s, and beyond. What changes is the mechanics. What changes is the timeline. What changes is what's important. But intimacy itself? Intimacy is about connection, and connection doesn't have an expiration date. If you're in a relationship and you're noticing changes in your sexual function, that's normal. That's not a sign of failure. That's a sign of age. And understanding what's actually happening, cardiovascular changes, medication effects, psychological factors, gives you power to address it. You can work with your doctor. You can communicate with your partner. You can adapt your approach to intimacy. And you can continue to have a satisfying, intimate life. Comment if you're over 70 and still sexually active. Comment if you've experienced changes in intimacy and how you've adapted. Comment if this helps you understand that intimacy at 70 is possible and normal. I read every comment, and if this helps you understand that intimacy at 70 is possible and normal, I'd appreciate it if you'd like this video and subscribe. It helps more men over 70 understand that what you're experiencing is not the end of intimacy, just a different chapter. Thank you for being here. I'll see you in the next one.